This video will address urinary tract infection in the elderly as part of NU 621 Advanced Pathophysiology. Urinary tract infection in the elderly is a significant problem. They don't present the same as younger adults, and the treatments are much more difficult in the elderly. In the preparation of this video, these references noted on the next two slides were used. You'll notice the Loeb and colleagues article is from 2001. If you're going to use an article that is that old, it really needs to be a gold standard reference, the research article that subsequent research is based upon. Otherwise, articles and references should be no more than 5 years old. So I'll just let you look at these quickly, and then we'll move on to the next. Okay. While doing research on this topic, I found that most of the researchers did segmentalize the elderly population in regards to in whom the UTI occurred and where they were. So what we have here is that UTI is found in all segments of the elderly population. The quote-unquote walking well, chronically ill, as well as the institutionalized elderly. And each of these groups has a set of unique characteristics and needs and presents with different symptoms. Many times they are asymptomatic and their UTI is found because of some other reason. It is a common problem, and Matthews, Lancaster, and Israel found that UTI was the second most common infection in elderly women living in the community, and found that it is the #1 infection in institutionalized elderly women. Criteria for diagnosing urinary tract infection in the elderly has been taken from the CDC website. This information is readily available in many places, not just on the CDC website. The most significant symptom listed here is the last one, the change in mental status. This is seen very frequently in the elderly rather than being able to express that they are having painful urination or chills. So some of the criteria include bacteria in the urine at a specific level, pyuria demonstrated by greater than or equal to 10 WBCs per field. The symptoms include dysuria, new onset urinary frequency or urgency, changes in appearance of the urine, chills and fever, new pain suprapubic or in the flank area, and new or increasing incontinence, as well as change in mental status. The next slide addresses the challenges that you will find in diagnosing urinary tract infection in this population. The signs and symptoms can run the gamut from classic signs and symptoms, which are most often found in independent elderly, to the atypical presentations of increased lethargy, delirium, fever, and anorexia. In our cardiology practice, the majority of our patients are elderly, and many of them come for their routine cardiology visits, having been in the hospital for urinary tract infections. The way it was found and diagnosed was a family member would report their loved one was not acting right, or was confused, or didn't respond when spoken to, which represented changes in the way the elderly family member always interacted. The family didn't know what else to do, so they took the loved one to the emergency room where the UTI was diagnosed. What we found as soon as they are treated and the treatments start to work is that all the symptoms go away, and then they are their old selves again. It's pretty amazing. So challenges, besides being asymptomatic, include being present in up to 30% of ambulatory elderly. And in institutionalized elderly, urinary tract infection is as high an incidence as in 50% of that population. And it is found in nearly all the catheterized patients. You've got the classic signs and symptoms, as I mentioned, but you also have the atypical presentations that I had listed for you, such as increased lethargy, delirium, blunted fever response, and anorexia. Treatment recommendations follow basically the same recommendations for the younger adult age groups. Local antibiotic resistance patterns are important considerations because this will give you an idea of an antibiotic that may not be effective in the elderly living in that area where the antibiotic resistance may be high. This also applies to anyone of any age who would need antibiotic therapy. Some of the other things to consider are special attention being paid to the severity of the illness, the living conditions in which the elderly is found, existing comorbidities, presence of external devices, local antibiotic resistance patterns, and the ability of the patient to comply with the therapy. The article by Loeb and colleagues in 2001 developed minimum criteria for the initiation of antibiotics for residents of long-term care facilities. Back then, Loeb and his colleagues found that this was a significant problem and remains so today. It's such a significant problem that in 2013 the CDC actually published specific guidelines for the use of antibiotics in nursing home residents. This slide addresses our task as healthcare providers. It's not necessary to memorize these treatments at this point, as they do tend to change over time. This is dependent on the significance of antibiotic resistance and, of course, new medications. Sometimes the newer drugs are not the answer, and the elderly respond better to the older tried and true medications. Thanks for your time. Please look through the references that are provided. They are really very good. There are many, many references out there, so feel free to use one that you are comfortable with. Again, download them into your tablet or smartphones because the CDC comes out with new recommendations fairly frequently, and you'll always have an updated guide. Happy hunting for sources that work for you. And if you have questions, concerns, or issues, just let me know. Thanks again for your attention.